nurse who works at a Queens hospital says she took all the safety precautions that she could, but still she tested positive after fainting on the job. To make matters worse, she's also 6 months pregnant. Joining us is Starr Lentz, registered nurse at Long Island Jewish Forest Hills. Starr, thank you for spending a little time with us and sharing your story.
Thank you for having me.
Absolutely. So give us an indication of how you came in contact, or do you know when you possibly contracted the coronavirus? It's got to be difficult working as a nurse and being pregnant, because a lot of moms out there are looking at these cases and worrying about, what could happen to me and my baby.
Well, I didn't know when I contracted the virus because I didn't have any symptoms. All I knew was that we were getting a lot of patients that came in sick, and, as a nurse, it was, my duty to care for them the best way that I could. And
so when you fainted on the job, was that when you took a test?
Yes. I had went to work. I was feeling fine. I didn't really have any indication before me getting short of breath and fainting that I was feeling sick or anything. I just felt lightheaded and dizzy, and I wound up fainting. And then that's when my job actually
tested you. So walk us through,
yes.
I'm sure you were very nervous and wanting to get answers then. Okay, so now that I'm positive, what does this mean for me and my child going forward? Were they able to provide you with any information?
Well, they sent me home, and it took 2 days for me to get my test results. Once the test results came in, the infectious control team at my job called me, and they gave me instruction to contact my OB doctor. I have an immunocompromised son at home that has sickle beta thalassemia. So of course they wanted me to contact his doctors and to take instruction from there. So it was at that time that I actually started feeling, well, no, I didn't feel any symptoms, but I started getting a little nervous, not just for myself, but for my family.
Of course, completely understandable. It's a bit of a triple whammy. You're positive. You don't know what the situation is with your unborn child. Now you have another child that is immune compromised. Now, did he contract the coronavirus?
Through the grace of God, I don't think so. He hasn't shown any symptoms. He hasn't shown any indication of him not being well. The same day that I got my test results back, my OB, while I was on the phone with my team, felt like my breathing wasn't where they wanted it to be. So I was immediately hospitalized. My husband was instructed to take me to the hospital immediately. And so I wasn't really home during my my time after diagnosis.
Have you been told? Yeah, have you been told at all whether this can be passed on to your unborn child, or is that information just still not available since we haven't done a whole lot of research on this just yet?
I have not been told that. From what I've been reading and the research that I've been doing, that there have been mothers who are positive, who babies came out non-positive, but that's not facts. That's just what I've been reading through articles and what I'm finding on media.
Yeah, it's a bit of a learning curve for everyone involved here. Now, have you been cleared to go back to work, and how are you feeling now?
I feel great right now. I have not been cleared as of yet. I have to, of course, see my OB, and I have to see my primary before they can allow me to go back to work.
Well, we wish you and your entire family and that baby that you're carrying the best of luck through this. Stay safe, stay healthy, and thank you for what you do as a nurse to save other lives out there. We do appreciate all of it.
Thank you so much.